Welcome to the Microdose Diet. I am your host, Peggy van der Plassche. So today I'm super thrilled to introduce my guest, and I will make a big effort to make sure I am not butchering his name, and please jump in if I do. So it's Dr. Zeev Neuwirth. Did I pronounce it?
Perfect. Oh my
Oh,
God, that's the
yes.
best pronunciation I've ever heard, Peggy.
Thank you so much. So you are a seasoned, and when I say season, I'm not giving you justice because I think it's way more than season. Healthcare executive, you have more than 30 years of experience in clinical practice, operations, innovation. You had held pivotal roles, including Chief of Care Transformation at Atrium Health.
Mhm.
You are also the author of two very influential books, Reframing Healthcare and Beyond the Walls. You
Mhm.
host an amazing podcast. You know, I'm a huge fan of your podcast, which is
Thank
called
you.
Creating a New Healthcare. I really recommend anyone who's listening
Mhm.
to really follow that podcast because it's amazing, amazing guests and very good interviews. You ask very insightful questions and you leave enough space for your guests to also answer. So I really recommend, love your podcast. And your work has been featured in Newsweek, Forbes, Fast Company. So you're really, I would say, a thought leader in the space with all the content. So thank you so much for being here. It's super exciting to have you.
Well, my pleasure, Peggy. And I'll say the one thing about healthcare, I've been in it for almost 40 years and like you say, a bunch of different roles and constantly learning. But the thing that shocks me about it is I learn every single day. I'm just literally even this morning picked up some stuff and read it, and I learned something new today, yesterday, the day before. So it's very stimulating. It's very challenging, and I'm in it because I really hope we can change the trajectory of where we're heading, which is pretty concerning. Yeah.
Yes, but thank God we have, thought leaders like you that are coming and bringing, to your point, 40 years of expertise in multiple areas. So I
Mhm.
know you're passionate about primary care. So we're going to
Mhm.
start with that topic. So, um,
Mhm.
what does a reimagined ideal primary care system look like to you? And how does it really address, the problem of the current system that you were mentioning needs some improvement?
Yeah. I mean, I think primary care, it's a great question, and it probably is one of the most important questions in healthcare today. Primary care is, and just about every expert I've ever interviewed, read, talked to, studied, says that primary care really is the keystone. It's really the key to any healthcare system. And the reason it's the key is for a couple of reasons. One of which is that, it's really preventing bad things from happening is really
Mm,
that's what has to happen. The current system is really structured, and we can talk about the different facets of it from largely from the incentive,
yeah.
how we make money, the revenue model, business models in healthcare are structured really to be not proactive and not preventive, but quite the opposite. And so
Exactly.
it's, the system, if you look at it and you break it down, it's perfectly constructed to let populations get sick
Hmm.
and get, chronic diseases, which by the way, make up over 85% of all costs across the world now are not infectious diseases, are not trauma. It's now chronic diseases like
Hmm.
obesity, high blood pressure, high cholesterol. These metabolic diseases, these
Yeah.
syndromes actually lead to the really tragic consequences, which we're seeing of, cardiovascular disease, heart attacks, and strokes, and actually even to other debilitating diseases, whether it be rheumatologic arthritis,
Hmm.
all the musculoskeletal injuries, all the surgeries that happen, largely a result of metabolic health, of overweight, of lack of
Yeah.
prevention and proactive care. And so, so we need to, when you say reimagine, it's really not reimagining. It's kind of going back to what primary care, where we all know, and by the way, the literature shows us, when you have preventive primary care in a community, when that is part of the community, what you see is people living healthier, living
Yeah.
longer, healthier lives, and the cost of care go down.
Exactly.
And so it's really, I mean, we need more primary care. We only at this point pay of all the healthcare costs in the United States, only 5% of it goes to primary care.
Mm,
5%. That
mm,
means 95% goes to everything
mm.
else, goes to administration, bureaucracy, all these high-tech procedures, which quite honestly, again, not for nothing, but if I gave you a choice and I showed you this beautiful building with these really incredibly brilliant people and this state-of-the-art technology, and I said to you, when you get your stroke, I'm going to take you into this beautiful building, or you get your cancer, or you
Yeah,
get your heart attack, and I'm going to have these people do stuff that is just magical to you. And I said, that's behind curtain A. Behind curtain B, I'm going to help you actually prevent ever getting a heart attack or a stroke or cancer. Which would you choose?
yeah.
And by
Well,
the way, curtain B costs a lot less for you.
on top of
And
that,
on top of that, so
yeah,
but that's the obvious reimagining of primary care, and yet it flies in the face of reality. We still do not promote primary care. We are not paying for primary care. We're not as an industry, we're not endorsing it. We're not supporting it. Despite all the lip service, you look
yeah,
at where the money goes, and the money is not going to primary care. And the other part of it, I'll just close with this, although there's a lot more to be said. The other part of it is that part of paying for primary care, it's not just about the money, funds, and yes, we have to pay more to for these physicians, but it's also how we structure it and resources. So think about this: a surgeon goes into an operating suite. Does the surgeon go by herself? The answer is no, of course not. They have a whole team that prepares the
hmm,
operating suite, all kinds of technicians and people managing all the logistics of the equipment and all that sort of stuff in the operating suite. Then when the surgeon walks in, she has a team around her, the anesthesiologist, the
yeah,
nurses, the other prep people. Yet when a primary care provider walks into a room, there's only one person in the room. That's the primary care provider. There's no very little support. Who's
yeah,
prepping the patient? And in primary care and prevention, so much of it is understanding the patient, having the time. So
yeah,
you
hmm,
cannot, in 10 or 15 or even 20 minutes, you can't get to know a
yeah,
person. You can't understand them. You can't talk about their nutrition and their sleep and their relationships. And that's what primary care is. You can't talk to them about their family life.
yeah,
This is really, it really is a whole cloth change. And what pains me the most is we have such brilliant leadership in all aspects of primary care, and I don't see any one of them. I don't care if it's on the hospital side or the pharmaceutical side or the device manufacturing side or the technology side or the insurance side. I don't see anyone promoting what I just described,
yeah,
which is basic common sense. And the science and the evidence is so overwhelmingly clear that this is better for us as individuals. It is better for our communities. It's better for our country. And it will improve care, improve health and lifespan, and it will radically reduce costs. And yet, I don't see any leaders talking about it or promoting it. It's you only hear about this when someone like yourself asks someone like me that question, or if you happen to go to a primary care conference, which by
yeah,
the way are getting smaller and smaller because there's far less primary care physicians today than there ever was before. And then some people say, well, what about, alternative like nurse practitioners and
hmm,
PAs and things like that? And the answer is I agree with that, but those numbers are also dwindling. And by the
yeah,
way,
hmm,
if you're a PA and you go to school for 3 years and you have a choice to go into surgery and be a surgical PA,
yeah,
you'll actually earn more than the primary care doctor. Whereas
exactly,
if you go into, be a PA in primary care, you could earn literally a half, a third, a quarter of
yeah,
what you would earn, being a surgical PA. So I think the economics, the incentives, the whole, business model. And again, it really, really upsets me. It pains me because I know how brilliant our leaders are in healthcare. They're just, I mean, I'm in awe of so many people in traditional healthcare and emerging models of healthcare, and yet I see very, very little being done to promote what is the single
hmm,
most critical
hmm,
part of healthcare, which is preventive,
yeah.
proactive primary care.
So, and that's, like I'm 200% with you on that. The best way to manage health is to stay healthy versus to have amazing care. Seems obvious, but so one of the question, when I hear you answer my first question is why is that? Is it because it's difficult to make a business case with prevention? Is it because it's less exciting than having this beautiful building with this very, um, smart people? Why is it that we're still struggling understanding? I think many people agree that prevention
Yeah.
is better than managing of sickness.
Yeah, when I wrote my first book, Reframing Healthcare, I had a mentor who is very, very savvy, smart businessman, and been in healthcare for a long time. He actually was one of the creators of the Minute Clinic, CVS's Minute Clinic. He was there at the start, and actually was there when CVS bought it from him and his colleagues. And when I wrote my first book, he said, Zev, the one critique I have is if you really want to understand healthcare and you really want to talk about healthcare, follow the money.
Hmm.
That was his golden rule. Follow the money. And now that was a few years ago when he said that to me. It was 2018, probably before my book came out, the first book. And so I would say to you, that's the answer is follow the money.
Wow.
There is so much revenue, so much margin to be made and it's spread across so many industries, right? If I, think about it, and I really don't like talking about healthcare this way, but it's just it's what I would refer to as dystopian, right? It's
Hmm.
the
Hmm.
opposite of utopian. It
Yeah.
is it is you really you it's almost like a movie, right? One of these, movies of the future, but the future is already here. I
Yeah.
mean, if we keep the population and again, no one's to blame this. I can't point a finger at anyone
Hmm.
or any
Hmm.
even stakeholder, but if you look at the whole system, it's really upsetting. I mean, everyone benefits. Everyone benefits from people being sick, from people having
Yeah.
tragic things happen to them. So, and the pharmaceutical industry benefits, the device manufacturing industry benefits, the insurers benefit, and the hospital systems benefit off of disease and not just illness, but severe
Yeah.
illness and
Yeah.
stage illness. There's tremendous profit to be made off of it. And then, you go outside of even healthcare, you go to the food industry, right? And
Hmm.
so tremendous profits to be made selling stuff that is not healthy for us. And
Yeah.
so, it's not just the healthcare industry. When I think of health, if I was now in government, I would actually reorganize. If the president called me up and said, we need you to reframe healthcare because this is we're just incrementing, which is the point of my first book was basically like, I hear the word innovation. It's very limited in
Yeah.
what we're actually doing.
Yeah.
It's really incremental, exactly,
Yeah.
Peggy. And I think we need a reframe, which was the whole point. I gave example after example of individuals and groups that we're actually reframing healthcare. And there's
Hmm.
almost like there's a roadmap, there's a process to it. I
Yeah.
observed and I shared. But I think that, I think we have to go beyond. I think we have to look at, our community, our social context,
Yeah.
our food, our environment. This is what determines health more than anything else. I mean, you know what the number one determinant of health is? The number one determinant.
Is it BMI or waist size?
That's a good guess, but it's how much money you make.
Oh, yes, of course. Yeah.
Right?
It's even
Right?
before. Yeah. Yeah.
Even before that.
Yeah.
And
Yeah.
so, we know that in every great city in the United States right now, the difference in lifespan between the
Yeah.
wealthiest zip codes and the lowest zip codes is 30 years. 30 years.
Oh, I thought it was 15, 30. Oh
Yes.
my God, that's insane. Wow.
I
Okay.
think is then yeah, it's 3 decades. I mean, we essentially have created third world health countries
Yeah.
around the greatest cities in the world. I
Hmm.
mean, Chicago, New York, Atlanta, Boston, San Francisco. I mean, you name it, all these Nashville, all these great cities.
Hmm.
The difference lifespan could be 20 to 30 years. And I've heard this number from epidemiologists and professors at the schools of public health. And, they talk about it, it's their backyard. And
Yeah.
so again, I think the core issue is and let me say that is money and following the money and revenue
Hmm.
and some people will call it greed,
Hmm.
we'll call it corporate greed. I'm not gonna argue with that term because I
Yeah.
think that there is a greed to it because and I say that because I'm not opposed in no way, shape, or form. Am I opposed to people making money and
Hmm.
earning, profits and margins?
Yeah.
What I'm opposed to is when that comes at the cost of actual health
Yeah.
for the customers.
Hmm.
And I think that's what we're seeing. And it's literally destroying our communities. It's
Yeah.
destroying our, I mean, it is, the healthcare costs are literally have been a tax on the American workers for
Absolutely.
decades,
Yeah.
right? I mean, it's literally a tax. And it's holding people back from actually being able to thrive. And it's really, I mean, this is not me making this up. Dave Chase from Health Rosetta was the first one I read who wrote this, which is, American healthcare is literally it's destroying the American dream,
Yeah. Hmm.
single-handedly
Hmm. Hmm.
destroying the American dream. It's
Yeah.
if healthcare was a foreign nation, we would have gone to war with it. Yeah,
Yeah, and it's interesting the way you frame it, and I see it with many ramifications. You mentioned obviously the food industry, and I was in finance before, and this mindset of you need to work 80 hours, 100 hours, 120 hours, so obviously you eat poorly, you don't sleep, you're obviously
right,
stressed, anxious, and we have glorified that. You know,
right.
and
That's true.
it's really turning the system on the head and glorifying being healthy and glorifying actually a system that can make as much money keeping people healthy than making
I
them sick.
that's I
But
think
it's
that's right. I think that's exactly right. I would love for the system to be as profitable, but by keeping people healthy. Yeah.
Exactly. And so talking about the role of prevention, promotion, because we agree that actually that's where it starts in order to keep people healthy and also help the healthcare system. So what do you think would be really the most impactful ways to integrate, the principle into primary care? And how can we,
Mm.
incentivize the providers? Because as we know, we need to follow the money.
I mean, I think w one of the real levers, I think the biggest lever in health right now, from what I've been reading, remember I said before, I'm learning all the time. I've been reading quite a bit over the past year about metabolic health.
Hmm.
And this is something that we did not study in medical school or in training. And in fact, quite the opposite. We were taught lies. And there's a great book by that
Yeah.
just came out, right? Lies I taught medical school by Robert Lufkin. And that's one of dozens of experts I could refer you to or talk about, some of whom I've read and some of whom I've also interviewed. But there's a cadre of experts that are coming out now, sort of out of the woodwork, and they're basically saying everything we learned about health and nutrition was really wrong, inaccurate.
Hmm.
Some of it was purposefully inaccurate. Some of it was right, and so it was lies, and we
Yeah.
were fed lies for decades since the 60s and 70s. We've been the biggest. I mean, if you want to talk about reframing, we in the last 3, 4 generations, we have been the biggest experiment in negative public health that has ever happened in the history of mankind, where we've had our diet infused with toxic chemicals,
Hmm.
where we've had our diet infused with, corn syrup and
Yeah.
these sugars and carbohydrates. It is, people talk about the drugs, like heroin and
Hmm.
opiates, and
Hmm.
I mean that those can't hold anything compared to what
Yeah.
the food industry has done. I mean,
Absolutely.
sugar is the other white powder, and it's
Hmm.
much much more addictive for a much much larger, expansive percent of the population, myself included.
Yeah.
I mean, we have really been inducted into an experiment in unhealthiness. And thanks to the food industry and along with the pharmaceutical industry, along with the healthcare industry, and again, this is just fact. It's not even. I'm
Yeah.
not. I wish this was. I wish I was being paranoid. I wish this was conjecture. But I've read too many experts, and
Exactly.
these are people who, again, someone was asking me the other day. I've heard so many different diets. Who do I follow? And I said, my simple rule is, I look at people who have literally spent the last 20, 30, 40 years studying, physiology, people who have credibility, who know the science, who aren't there selling, a vitamin. There's so many
Hmm.
people selling vitamin pills and potions. And, we know all those people. I'm not going to name names.
Hmm. Hmm.
They're highly popular people and, everyone's a sucker. I mean, I'd love to have a magic pill. I really would.
Of course.
Right? But I really study the people who are the actual scientists, the actual
Yeah.
doctors who know this, who are not in it to make a quick buck or to sell some product or potion. And I read them and I study them. And the one commonality amongst just about all of them is they did this, it started with themselves. They were looking at themselves. It's really shocking how many of these doctor scientists started out by saying, I started to get into my 30s, 40s, 50s, and I started to get high blood pressure and high cholesterol, and I got overweight, and my doctor was putting me on multiple medications. I was like, what's going on here?
Yeah.
And they went back to the science and they said, oh my God, we were never taught the real
Yeah.
truth
Yeah.
about metabolic
Hmm.
health.
Hmm.
And so I think, the number one thing I think we need to focus on is nutrition. And
Yeah.
it's you asked about practical. Is it practical? I don't know because there's so much money and the marketing and the social media
Yeah.
and the industries that are promoting these different types of foods. They're so sophisticated. I mean, as an individual, good luck. I mean,
Yeah.
you have to be a rebel. You have to literally be
Absolutely.
a healthcare rebel and you have to protect yourself, cocoon yourself. I don't know. The people who are healthy, I don't know how they do it. You
Yeah.
really, really, it takes energy because I'm just a little individual. All the executives in the food industry, the scientists in the food industry, the marketing people, and then there's nothing to combat it. My healthcare system is not helping me out in any way. And so they don't know enough. They're not prepared. That's not their
Yeah.
focus. And so there you are as a little individual against, multiple industries that are literally inducing you to be unhealthy.
Yeah.
I mean, they're telling you just get in your car and drive instead of walk, sit in your couch and watch things and, and your computer and this instead of going out and doing something. We've become a culture of consumers as opposed to a culture of creators.
Yeah.
And I think fundamentally, that is so demoralizing when we wonder again, there's so many contributions, of course, to depression and anxiety and loneliness, but I think a large part of it is we've been suckered into becoming consumers. And that's what everyone talks about is how
Yeah.
much they can consume and how fancy the consumption is and how much. And as opposed to, I went out and I did this, I wrote this, I
Yeah.
sang this song, I talked to this person, I created my own entertainment, I created my own activity. It's really I think that's really it's such a deep, deep fundamental shift in our humanness, in our being. It's going to take a lot, and so I don't know if it's practical. I
Yeah.
know that's the solution. I just don't know
Yeah.
how practical it is.
Yeah. And I love that you're saying it because I agree with you again back to the reframing. It's healthcare is a piece of the puzzle. But it's an elephant, and we're just looking at one over ear when we look at healthcare because it's
Yes,
all
that's right.
the things that I'm 47 that we've been fed, and not just fed as a nutrition, but fed mentally. What is it
That's right.
supposed to be? What we're looking for? I was talking about this 80, 90
Mm.
hours work week. It's just one piece of a puzzle. You're supposed
Yeah,
to do that
yeah.
in order to buy the things, and then you post them on Instagram, and then the the cycle goes back again, and
Yeah,
I couldn't agree more with you. I think it's a total reframe of our values and starting with critical thinking and
yeah,
asking ourselves the question, does it even make sense? Who benefit from that? Am I being
yeah.
manipulated? And unfortunately today I find it's very easy that when you ask questions, people are like, oh, you like conspiracy theory? I'm like, no, I do believe that a lot of the things I was told were not accurate. I don't think I'm saying that the earth is flat. I'm just
Well,
saying, food is
well,
not healthy.
Peggy, I mean this notion of conspiracy theory, I think it's so funny because if you don't think you're being manipulated, now if you've shut off, your television and you've shut off your social
Uh,
media and you've shut off radio, um, and you don't go to the stores or malls, then maybe you have a chance of not being manipulated.
Exactly.
But the moment you turn on any of those, you are being manipulated by analysts and scientists that you have no idea. I mean, these are the PhDs and the postdocs and the MIT grads and Stanford grads. These are the people that are doing it. And again, this is not conspiracy theory. This has been documented. This is
Exactly.
over and over and over again. It's so and again, it's so hard to blame anyone. And then the question I think becomes, so what can I do? And that's where I'm
Hmm.
really sort of starting to, if I read another book, which I'm thinking about, it's really about this notion of, so what can I do? What
Yeah.
are some of the practical steps I can do to protect myself, to protect my family, to protect my community from, essentially this culture of manipulation, this culture of unhealthiness. And I'm interested in this for myself and my family
Hmm.
and my friends and my patients. And so it's something that I'm actively pursuing. It's funny. My wife is a physician too, but she's far more practical than I am. She's much more grounded. And I said to her, I think I'm going to go on this diet or that diet. And she says to me, well, why don't you just stop eating M&Ms at night? And I said to her, I said, yeah, it's a pretty good idea. So I stopped eating M&Ms at night, and which, by the way, took some doing to get
Yes,
myself out of that
exactly.
habit.
Exactly.
But I've literally lost like 10 pounds. I've done nothing but stop eating
Yeah.
M&Ms,
Yeah.
and it's just like, wow, it's like there are things we can do that are like even single things that can create huge changes. And it's just, now I'm hoping I can stay off them now that I'm weeding myself. And again, don't want to disparage any particular company or industry, but it is
Yeah,
just an example.
exactly. And you mentioned your third book, which I'm looking forward to see. Let's talk about the first two that you've already written.
Yeah.
Um,
Yeah.
Can you just give us just a quick key lessons from the book that you believe that healthcare innovators, healthcare leaders need to hear? So we spoke about prevention, promotion, asking ourselves questions. I'm gonna call the spirit of your wife. Is there something very grounded or one or two key advice they can implement maybe tomorrow morning?
Well, the first book was really this pattern I saw of these people who were literally transforming healthcare, and they had a different way of thinking, a
Hmm.
reorientation. They redesigned healthcare based on that, and then they actually put their money where their mouth is. They reorganized and resourced it, and so that was the basic three steps. What I'm seeing, actually, interestingly enough, is that if you can do that for your own life, I mean, it is
Yeah.
it is a recipe for transforming yourself, your life, your leadership, whatever you want to call it, your parenting, is look for that different orientation, redesign what you do and how you do it, and then you've got to put your money where your mouth is. You've got to reorganize and restructure and resource, the thing that you've redesigned.
Hmm.
Um, the other part of that book was also marketing. We have marketing departments in healthcare, but we actually don't really do marketing in that marketing. The essence of marketing is really understanding your customer, understanding their needs and meeting those needs. If we actually adopted the philosophy and the science of marketing in healthcare, we actually would be a lot better. It's like,
Hmm.
really, because, to really understand who are your customers, what are their needs, how do I meet
Yeah.
those needs, how do I know I met those needs? We are very, very demands supply side oriented. So I give you what I've been trained to give you as a
Yeah.
physician. It's
Hmm.
about me. It's
Yes.
about the industry. It's very industry centric as opposed to really discovering what
Hmm.
is it that you actually want. Now, measuring even things like measuring patient satisfaction, do you know the questions are, how did I do as a doctor? Tell me
Yeah.
how good I am, right?
Yeah.
Tell me
Yeah.
how good your experience was of me,
Yeah.
right? Even the questions we ask are not about the customer. They're
Yeah.
about me.
Yeah.
And so me, the doctor, me, the hospital, me, the provider, me, the pharmaceutical company, me, the insurance company, as opposed to did we actually meet your needs in the way you
Yeah.
wanted them met? Did you get what you wanted in the
Yeah.
end?
Hmm.
That's not a question we ask.
Yeah.
Rarely do we ask those kinds of questions. So that
Mm.
was the point of the first book. I called it The Marketing Mindset. And
Mm.
the second book I can share with you if you'd like to hear about that. But
Oh, yes, of course. Yeah.
so the second book is really interesting. It's called Beyond the Walls. I
Yes.
really love it. It the title Beyond the Walls I stole it from Jim McKelvey, who created this product called Square.
Oh, yeah.
He started out as a glass blower and he had trouble getting paid. People would say, "Oh, I'll send you a check or I'll pay you for this piece of glass you made and this art," and he never got paid. So he invented Square. And of course, now when you tap your card
Hmm.
on
Hmm.
that's Jim McKelvey's original stuff. And so he's a multi-billionaire. He wrote a book about innovators. And he said, we used to live in dark ages, in medieval times. We lived in these cities surrounded by these huge stone walls. And they were there for a reason. They
Hmm.
protected you
Yeah.
from animals and from
Sure.
the elements and from, marauders and stuff like this and enemies. But it really sucked being inside the city. It was crowded. It was pestilent. There was garbage all over the place. It wasn't fun. It was to be in the city, but it was better than, safer than being outside.
Yeah.
But he said, listen, if we had stayed behind those walls, think where we would be today. We'd still be in the dark ages. I
Hmm.
mean, communication, culture, commerce all came from us getting beyond the walls. And he said, it was those few people who were willing to go beyond the walls, those
Mm.
entrepreneurs, those
Yeah.
pioneers who were brave enough. And he said, people talk about entrepreneurs a lot. He said, entrepreneur is someone who really you're going to either survive or die. I mean,
Hmm.
and you are willing to take that risk on in order to advance yourself and to advance society. And so I stole that sentence from him and that was the title of my book because the people I've been studying and I've been interviewing, as you know, people for about a decade now, in-depth interviews, and then I transcribe those interviews and I study those interviews looking for patterns and processes. And those people, I've wondered why am I so inspired by them on an
Hmm.
emotional level, and why am I so intrigued, and what is so attractive about them? And for me, what I finally realized from Jim McKelvey is these are the people who literally are willing to risk it all to
Hmm.
improve
Yeah.
themselves and improve society. They're willing to do that. And so I wrote the second book, and the bottom line is there are three strategies that we need to adopt. The first is we have to not only accept, but we have to really advance our digital technology. I mean, I've talked to so many people who come from outside of healthcare, and then they go into healthcare, and they're like, "Oh my God, you're like 30 years behind
Yeah.
every other
Hmm.
industry.
Yeah.
Your analytics, your data. I mean, it's all ancient.
Yeah.
It's like going back 30 or 40 years in
Yeah.
time." I've heard that so many times from people. We have to really advance our data
Hmm.
analytics, our digital technology. That's number one. Number two, we have to change our fundamental business models. That
Hmm.
is so
Yeah.
critical. I actually think the most innovative things that are going to happen in healthcare, the real transformative innovations, are not the science and technology. They're actually the business model
Hmm.
transformations.
Hmm. Hmm.
How we get paid, what our incentives
Yeah.
are, I mean, that's really for me the exciting part of
Yeah.
healthcare transformation. And then the
Hmm.
third is the most important because you could have business model transformation and digital and still be dystopian. And I think we even people who are leading innovators are still stuck because what you need to have is a third strategy, which is called humanism. And every single person, every single one I've interviewed for 10 years has that as their core principle.
Hmm.
And it's not just like a phrase or a marketing thing they put on the side of a bus or on a billboard, which is what most do. It really is they are demonstrating the humanity in their outcomes and how they incent internally. It means getting rid of racism and ageism.
Hmm.
Um, and sexism and ableism in healthcare. It really means not just, hiring a couple of people and throwing them and creating a department of equity and saying,
Yeah.
look at us, look at our equity. We do. No, it means really embedding that into the business model, into the technology itself. And so that was sort of, and then I go throughout the book and I share how these three strategies are inherent in every example I talk about.
And I know we're out of time, but I cannot leave you without asking about the network, which is exactly the last piece you were
Ah.
mentioning, and this humanistic rebel leader who are now part of your network. Do you want to tell us a bit more about that? And then I'll let you go.
I think both on a personal level and a professional level, if you want to change healthcare, what I've observed is, and it took me a while to realize, the people that are really making the change, they are humanistic rebel leaders. And what I find is they're often alone, myself included. It's one of the reasons I've been doing the podcast is to really connect and network.
Hmm.
And so I actually created a site, a web part of my website, and it's called hashtag HRL, Humanistic Rebel Leaders. And my hope is that it will attract, and I put video interviews and short clips with humanistic rebel leaders that are so unbelievably inspiring.
Yeah.
But what I'm hoping to do is really create a home base for humanistic rebel leaders and network so that people can learn from one another, collaborate one another, potentially work with one another,
Hmm.
and create with one another. So anyway, if people are interested, it's hashtag HRL. If you go to ZeevNeuwirth.com or ZeevNeuwirthHealth.com, go to my website, you'll be able to click and get into the HRL site.
Yeah, and anyone who's listening or watching or reading the newsletter, I highly recommend the network. I'm a member and I really, really
Thank
love,
you.
having the opportunity to learn about all these leaders and, every interview, every snippet is right to the point. I love it. So thank you so, so much. I
Thank
was
you.
telling you before we started the interview, we'll probably need to have a second conversation in a few months, and this is confirmed. But thank you for all your
Thank you.
insights. I think anyone who's listening today really got a little aha moment. And okay, we need to really start asking ourselves the right questions. Are we
Mhm.
answering the wrong problem while actually we need to really reframe healthcare? So thank you so, so much for your time and your insights.
Peggy, such a pleasure. Such a pleasure. Thank you.
Thank you so much. Bye bye.
Bye bye.